अभी ज़्यादा स्टूडेंट्स नहीं हमारे साथ जुड़े हैं जो देख सकते होंगे।
Yes, ma'am.
हाँ जी। वेरी गुड आफ्टरनून।
Please start, ma'am.
Thank you, sir. Very good afternoon to all of you. Today we have our last session for this personality assessment, and I'm going to talk about the block 4, that is dealing with the personality assessment itself. We will be discussing self-report inventories, projective techniques, few behavioral assessments with the help of which we can measure personality. Over last two lectures, we have discussed different theories of personality. We also came across different types of personality. There are traits, 16 factors, and many other varieties in the personality. But then we have to find out a standardized measure so that we can have an accurate identification of a particular personality pattern. So the first thing that I am going to discuss is self-report inventories. They are also called as self-rating questionnaires, and to more or less we often use these kind of inventories when we have to discuss about certain personality patterns. Now, these are the report inventories where the person is able to reveal the information about himself or herself. And in this kind of an inventory, the response can be in prescribed format only. Also, we call it as a crude tool because you don't have the accessibility to, or a lot of information, you can say cannot be accessible with the help of this inventory, but still we try our level best that in true or false or yes or no format we help to know the best of the person we can. Now, they are based on the principle that behavior is the manifestation of a trait. So, with the help of self report inventories, we try to assess the behavior basically, because behavior, whatever behavior is being displayed with the help of self report inventories, it is actually the manifestation of the trait only. Whether the person possesses that particular trait, maybe a trait of honesty, maybe extroversion, maybe introversion, or psychoticism or self control. Now, along with this, it also helps to measure whether there is the presence of a trait or not. And just not this, self-report inventories also measure multi-dimensional traits. So for that matter of the fact, we have single-oriented test or the multi-dimensional test. Now the self-report inventories are also called as paper-pencil test. People are asked to respond to different questions concerning their traits, values, attitudes, interests, and feelings. Self-report inventories also measure certain social or specific traits, you can say. As I said, the confidence level, the extraversion factor, etc. Also, self-report inventory tries to identify the adjustment of the person with respect to different aspects of his life. We have an inventory called Bell Adjustment Inventory that helps to identify the adjustment level in different domains. It can be home adjustment, it can be health adjustment, it can be social adjustment, occupational adjustment, and many more. Of course, emotional adjustment. Along with this, self report inventories tries to find out the pathological traits that are creating disturbances in one's life, and not just one pathological trait, maybe large number of pathological traits. We have different kind of self-report inventories, and few I'm going to discuss with you now. Then, not just talking about the pathological traits, self-report inventories, they also help to screen out the groups of individuals. So what group is going to fall into which category can be known with the help of self-report inventories. Apart from screening individuals, they measure the attitudes, interests, beliefs, and values of different people. Now, as I said, that self-report inventories have single trait test or the multiple dimensional trait test. So first, I'm going to talk about the single trait test. Now, in this kind of a test, any person receiving a high score or may receive a medium score or a low score. So with that respect to that score, we are going to identify whether the intensity of that particular behavior is high, low or medium. क्योंकि ट्रेट होना जरूरी है ना. अगर आप ऑनेस्टी का ट्रेट या आपके अंदर लेट्स सपोज एक्सट्रोवर्जन हम मेजर कर रहे हैं, so if you have that extroversion as a trait in yourself, I shall be able to find out with the help of your answers on the inventory itself that whether the person exhibits, display the traits of extroversion or not. So single dimension वाले जो test हैं, they provide separate measures of 2 or 3 traits. So एक trait से हम 2 या 3 तरह के personality patterns को find out कर सकते हैं. उनमें से एक ऐसा single oriented test जो है, that is Rotter's locus of control. And also we have sensation seeking scale and self monitoring scale, measuring the single traits, but at the same time different personalities being conveyed. Now multi-dimensional test. In multi-dimensional test, several personality dimensions are being measured simultaneously. Now multi-dimensional tests have an advantage. We can use them in the clinical setting also, and at one time or at one go, we can identify different traits or different factors present in the person. And for this, I would want to give the example of yesterday's theory given by Raymond Cattell. And he identified, as we had discussed, the 16 personality factors. So 16 PF fall under the category of multi-dimensional test. Now, what are the strengths and the weaknesses of the self-report inventories? किसी भी टेस्ट को जब हम यूज करते हैं, उनकी रिलायबिलिटी, वैलिडिटी या स्टैंडर्डाइजेशन की जब हम बात करते हैं, अपार्ट फ्रॉम दैट we also look into the merits and the demerits the test have. Now the first strength is it is very precise, of course. Why? Because there is a question, you have to answer that question in a provided format. Can be yes no, can be true false, or maybe a rating scale where you have to encircle that number, maybe 1 to 6 or 1 to 5. Easily administered. We don't need a kind of a professional training to administer that. And of course, they have greater reliability. Okay, whatever the results are being conveyed from the particular inventory, they are the reliable ones. So maybe self-report tests are considered as the reliable sources of identifying or measuring the personality. Certain weaknesses are also there. And the most important weakness is the chances of socially desirable responses. So maybe I am not a kind of a person that the trait wants me to answer. I am responding in that manner because I believe that my responses are going to affect my overall impression on the examiner. So हम socially desirable responses तब देते हैं जब हमें लगता है कि oh I am being judged and I don't know how my results are going to be. So it is better to say yes even I don't want to say yes to a particular question. Faking is the another thing which we can see in self-report inventories. So they can be faking good, Faking, faking good or faking bad. Now, faking good is, for example, a job applicant is there, right? And he's intentionally agreeing with those items he or she believes will create favorable impression in an employment situation. For example, I'm offering you the job and the job profile says you have to be punctual, dot 9 o'clock you have to reach, you have to do the field work also. So maybe you or any other candidate is not that kind of a person where you can spend maximum time in the field or maybe a sitting job, but you are just trying to say yes for it because you need the job. And once you step in the job, then it can be a problem for you and the employer as well. Faking bad. Now, when I don't have the, for example, I don't have the symptoms of being psychologically disturbed patient, I am trying to portray myself as that I am psychologically disturbed. The best example can be कुछ movies हैं ऐसी जिसमें आप maybe unintentional crime कर लेते हैं in with regard to your safety or protection. So you take the help of being called as कि आपको psychiatric help की ज़रूरत है. So you are okay, you are perfectly fine, but just to save your skin, you are faking bad that I am suffering from one or the other kind of a trauma, due to which I'm not able to handle the situation, and that was just done at the in the spur of that moment. Now, social desirability. A person might respond to items in ways that make him or her look good. Now, this tendency is called social desirability. Of course, to a certain extent, uh, I don't want to be portrayed as bad into the eyes of others. So maybe that is the thing that I'm trying my level best कि मैं अपना best response दे सकूं. Measures to avoid faking. How do we avoid faking the responses? We have validity scales. We have certain clinical scales with the help of which we can avoid faking. So in certain tests, for example, Ising personality questionnaire, if I talk about, in that kind of a questionnaire, we have a lie score, LIE, lie score. Because in that score, the number of items you are supposed to respond is maximum 6 or 7. So when the responses are beyond the score of 6 or 7, it makes us very sure that the person has given the socially desirable responses, and therefore we have to disqualify that person itself, and we shall proceed for another subject to conduct the test. So we have to be very sure when a questionnaire or a test is given to you and being asked to perform it, simply just do not try to say yes, 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 or you are simply repeating the no responses because maybe you are not interested or you don't want the other person to get to know you so well. Apart from that, we have certain personality inventories. And I think the first personality inventory, or not exactly the first, but otherwise, when personality theorists were trying to work on it, Jung tried his level best to find out certain personality inventories which can really help to get the real content from the person. Maybe giving some kind of a stimuli, and then at the same time trying to identify or measure what kind of solution or the response is being given by the person. So he developed what we call it as word association test. But before that, the first attempt to measure personality was done through a questionnaire that was made by Galton in 1880. So he developed a questionnaire for studying mental imagery, that's your inner world of perception and feeling. Then also Woodworth personal data sheet. Now this first systematic effort was made by Woodworth in 1918, where we can try to find out the neurotic tendencies concerned with the person. Now neurotic tendencies can be biting your nails, pulling your hair, depression, obsession, and basically these tests were screened or maybe prepared to prepare the individuals for being recruited during the World War One. So ये तब के time का है. If we talk about 16 personality factor questionnaire, yesterday we discussed those 16 factors as well. So with the help of statistical technique, factor analysis was done, and therefore very well versed test which is used these days to identify different factors in an individual. Yesterday we also discussed the ocean big 5 factor model given by Costa and McRae. So with the help of that model, there was another inventory developed that was called as NEOPI. NEOPI. That stands for Neuroticism, Extraversion, Openness, Personality Inventory. Then, influenced by Jung, the mother and the daughter, they developed a scale, Myers-Briggs type indicator. As I said, the idea was of Carl Jung, but at the same time, they were more curious to find out the 4 personality dimensions, and they were able to make out that there can be 16 personalities at one go which we can identify in a person. Can be introverted, at the same time sensing, thinking, judgmental, introversion, sensing, thinking and perceiving, introversion, sensing, feeling and perceiving. So a combination of these 4 influences would definitely help us to find out those traits also which we were not able to find out with the help of other inventories. The most popular and best clinical tool used by clinical psychologists is MMPI. We have different versions. The latest is the MMPI-2 that consists of almost 567 statements, and they have 8 validity scales. Recently, it has been updated with 2 more scales, and we have 10 clinical scales. Now, these validity scales are going to help us to identify whether the person is faking bad, faking good, or he or she is actually giving the honest responses to the inventory. Now, what are these inventories used for? So, particularly this MMPI that I'm talking about is used to identify the behavior patterns which are related to mild to severe personality problems. Mild can be just worry, and extreme can be even psychosis, that we call it as schizophrenia or schizophrenia. Now these validity scales, as I said, they are well established in the inventory itself. So time and again in an inventory, certain items, they are being repeated. Even if you go through the EPQ questionnaire, एक ही स्टेटमेंट को अगर उन्होंने एक एक्सट्रोवर्जन में डाला हुआ है तो उन्होंने एट द सेम टाइम साइकोटिसिज्म या इंट्रोवर्जन में उसको मोल्ड करके डाला होगा उसी आइटम को टू सी योर रिस्पॉन्सेज. हो सकता है एक्सट्रोवर्जन में यू आर सेइंग यस, just because you want to show yourself as, yes, I'm an extrovert, but the same question has been given a molded form in the introversion category, and then the examiner can find out whether your responses are true or not. Apart from MMPI, there's also one structured inventory called as Millen Clinical Multi-Axial Inventory, MCMI, and that's the third version going on nowadays. Now, this inventory consists of 175 items, and the age range we can use it is like 18 years and older. It takes almost 30 minutes to complete this inventory. And of course, just like MMPI, this inventory is also designed to assist with clinical and personality disorders that we find on Axis 2 according to DSM-5. Now, this inventory consists of 28 scales. So, the kind of possible diagnosis we can make in this MCMI third version inventory is like a possible diagnosis that I'm going to share with you, that the following person, or maybe XYZ we can say, because we cannot disclose the identity of the person, appears to fit in the following Axis 2 classification. So Axis 2 classification deals with the personality disorders, maybe antisocial, along with some dramatic personality features that we call as histrionic, and also certain tinge of paranoid personality features. I mean, this is how we make the diagnosis. After MCMI3 inventory, we have another structured inventory called as California Psychological Inventory. Now, this inventory is in the shape of true or false statements. 434 questions, 434 items. Generally, in a questionnaire, in an inventory, or in psychological terms, we call it as items. So they have 434 items, and the age ranges 12 to 70 years. 12 साल से लेके 70-year-old person तक आप ये inventory को use कर सकते हैं. It takes 50 to 60 minutes to complete the test, and this is designed for normal people to identify their personality. So this California Psychological Inventory, this focuses on the feelings, the opinions, the attitudes relating to social, ethical, and family matters. Now I'm going to talk about the projective techniques. Now, what do we mean by projective techniques? Yesterday, we were discussing the defense mechanisms. Maybe yesterday, day before yesterday's class, we had a talk on psychoanalytic theory. So, I was telling you that Freud has developed certain kind of defense mechanisms. जिसमें से projection एक ऐसा defense mechanism था, with the help of which we try to portray our own feelings, maybe my own thinking, onto other stimuli. The stimuli can be an object, picture, kind of a material, anything. So these techniques are actually, designed to help the clinical psychologists, because we do use these techniques in a clinical setting also, to identify the nature and the severity of that person's emotional disturbance. So Frank was the person in 1939, he coined the term projective technique to describe assessment methods that present people with ambiguous stimuli for which there is no obvious culturally defined to personality assessment. See, whatever stimuli I'm going to give you, right, वो कोई culturally based नहीं होगा कि भाई एक ही culture पे apply हो सकता है. उसमें एक universality है. our motive is to find out the feelings, the needs, or the ways how do you view your life. Maybe which I may not be able to find out with the help of self-report inventories. Now, why? What is the difference? Because I have a restriction in self-report inventories to give my answers in yes or no. कभी कभार ऐसा भी होता है ना कि at times you feel moody, not always, but there the question says either yes or no. So how am I going to be? Then I have a fear. Oh my God, I'm going to be portrayed as if I have an antisocial characteristic. But I don't have that. So that restriction, that problem can be sorted out with the help of projective techniques. Why? Because here my subjective feelings, I am being given a platform where I can share my feelings like anything. Maybe I can be given a situation where I've been asked to operate in that situation, a manipulative task, right? Maybe what if I say, like, further we are going to discuss the thematic perception test, where I'm going to be presented with a story, with a picture, and I'm being asked to make a story out of it. सो ऑल टुगेदर वो मेरा स्टोरी जो है वो मेरी परसेप्शन होगा, माई थॉट्स, माई फीलिंग्स. ऑफ कोर्स द demerit is maybe the observer's bias. Well, for example, when I am evaluating your story, so somewhere or the other हो सकता है I can go with your feelings, or maybe I'm not able to see the objective aspect or the scientific aspect of certain kind of things, and I'm portraying you as a very emotional person, but it can be emotional abusive relationship, rather than I'm saying no, no, you are going very well in your relationship. So why? Because there can be certain encounterment of the feelings, or maybe the transference, you can say. So of course, projective techniques also have demerits, but we still make use of them because to certain extent, we are able to identify those features, those minute details of the person which we cannot find out with the help of these objective tests or self-report inventories. So based on the classification, they said that projective techniques, they have been classified into different techniques, different categories we can say. So when I'm saying association technique, जैसे कि मैंने आपको बताया कि यूंग ने, कार्ल गास्टव यूंग ने कलेक्टिव अनकॉन्शियस के बिहाफ पे वर्ड एसोसिएशन टेस्ट बनाया, जिसमें you are given a word and you are asked to spontaneously respond to that word. For example, right now if I say wood, or if I say chair, black, red, horror, so whichever word comes to your mind on the very first go, you have to respond to that accordingly. You will not be given a time span that you have to think about it and then you have to respond to that particular word. Another is the Rorschach ink blot test. I'm sure आप में से कईयों ने इसके बारे में सुना होगा. हर्मन रॉशा ने ये इंक ब्लॉट टेस्ट डेवलप करा था और डिफरेंट इंक ब्लॉट्स थे, डिफरेंट कलर्स में, डिफरेंट शेप्स में, and the person diagnosed with one or the other personality deviation or any sort of pathology from psychological point of view is being asked to go through those cards one by one, taking your time, looking from different angles again, and finding out what that ink blot depicts. Now here again, the problem is maybe that picture can be a human figure for you, maybe not for the other person. Why? Individual differences. So this can be a merit in projective technique, that we do give consideration to individual differences in projective techniques. Then the construction technique. As I said, this TAT, thematic perception test, children's perception test, then picture frustration test that was given by Rosenweig, right? Certain pictures are there and you have to make a story, construct a plot, and as being an examiner, I'm going to evaluate. तो आप जो भी कंटेंट उसमें लिखेंगे वो आपकी पर्सनालिटी को दर्शाएगा. कुछ कंप्लीशन टेक्निक्स भी प्रोजेक्टिव टेक्निक्स का पार्ट है. उसमें से हम सेंटेंस कंप्लीशन टेस्ट की हम बात करते हैं, जिसमें आपको एक सेंटेंस दिया जाएगा, आई एम हैप्पी बिकॉज डैश डैश, आई एम वरिड डैश. सो दैट डैश फिल इन द ब्लैंक वाला जो एस्पेक्ट होगा, इट विल बी इवेल्युएटेड. एंड यस, जब आप ये टेस्ट परफॉर्म करते हैं, मैनुअल्स में हर टेस्ट के साथ एक स्कोरिंग पैटर्न दिया होता है, क्योंकि टेस्ट एक दिन में नहीं बनता है. सर्टेन एक्सपर्ट्स in that particular area, they are being asked, जिसको हम item discrimination, item validity, reliability, so ये सब चीज़ों से content validity, I'm sure आप RMS में ये सब पढ़ रहे होंगे कि reliability, validity क्या है. सो ऐसा नहीं है कि एक ही एस्पेक्ट की सारी आइटम्स डाल दी जाती हैं, और ये टेस्ट जो है, टेस्ट, रीटेस्ट, स्प्लिट हाफ रिलायबिलिटी, ये सब चीज़ों से गुजर के एक स्टैंडर्डाइज्ड टेस्ट बनता है. जस्ट फॉर एग्जांपल इफ ऐसे कि जो एक 10th का बोर्ड का एग्जाम है, दैट्स अ स्टैंडर्डाइज्ड टेस्ट, और जो प्री बोर्ड्स होते हैं वो आप अपने स्कूल लेवल पे जैसे भी है ले लेते हैं. तो एक एक एवरेज पर्सन के हिसाब से और उसकी डिफिकल्टी लेवल, देन ऑफ कोर्स द स्पीड टेस्ट, स्पार टेस्ट, डिफिकल्टी लेवल क्या रखना है. कुछ आइटम्स आप पहले इजी रखेंगे, फिर आप ग्रेजुअली उसको थोड़ा डिफिकल्ट बनाएंगे. सो इन सब चीज़ों के बाद ये टेस्ट कंस्ट्रक्ट करे जाते हैं. तो मोर और लेस काफ़ी चीज़ों का ध्यान रखा जाता है कि वन, रिजल्ट्स इसके स्क्यूड ना हो जाएं, कि वो एनपीसी को कंसिडरेशन में रखते हैं. हेट्रोजेनिटी मेंटेन करना है, सैंपल कैसा लेना है, एंड देन हर टेस्ट का एक एज रेंज गिवन होता है. कुछ टाइम बाउंड होते हैं, लेकिन प्रोजेक्टिव टेक्निक्स जनरली टाइम बाउंड नहीं होते हैं. बट येस, हम एग्जामिनी को इतना जरूर कहते हैं कि डोंट थिंक टू मच अबाउट इट. लेट्स सपोज देयर इज अ सेंटेंस कंप्लीशन टेस्ट, तो आपको मैं वो जो ब्लैंक दे रही हूँ उसके ऊपर आप पूरा अपना थॉट यूज करना शुरू कर दें, तो फिर शायद वो फेकिंग गुड और फेकिंग बैड आ सकता है. Then there are certain expressive techniques also in projective techniques, where the person is expressing the personality with the help of some manipulative task, right? कुछ interaction involve करी जा रही है, कुछ आपको material दिया है, और इसमें क्या है, I will be trying to observe the way you handle the material, not what you are doing with the material. कि आपने उसके फर्दर फंक्शनिंग नहीं, आपका वो प्रोसेस क्या है. अगर आपको डॉल्स दिए हैं तो आप डॉल्स की हैंडलिंग कैसे कर रहे हैं, या अगर आपको मैंने पिक्चर्स दिए हैं तो उस वक्त आपका माइंडसेट क्या है उन पिक्चर्स को देख के, मेरी ऑब्जर्वेशन वो भी होगी साथ ही साथ. देन ऑफ कोर्स देयर आर सर्टेन स्ट्रेंथ्स एंड वीकनेसेस ऑफ प्रोजेक्टिव टेक्निक्स एज वेल. जैसे कि मैंने आपको बताया है कि स्टैंडर्डाइजेशन के तौर पे अगर देखा जाए तो हम सब्जेक्टिव फीलिंग्स यहाँ पे मेजर कर रहे हैं, तो मोर और लेस यहाँ पे थोड़ी साइंटिफिसिटी जो है वो क्वेश्चनेबल है. लेकिन ऑफ कोर्स अगर स्ट्रेंथ में देखा जाए तो एक बेस्ट इनडायरेक्ट मेथड है ये, जिससे हम एक पर्सन के जो हिडन एस्पेक्ट्स हैं, मे बी वो फॉरबिडन ही हो कहीं ना कहीं उस पर्सन के लिए, कि वो कॉन्शियस लेवल पे उस तरह से नहीं लेके आ सकता है, लेकिन विद द हेल्प ऑफ प्रोजेक्टिव टेक्निक्स वो सामने दर्शा सकता है. We also have behavioral assessments, interview, case study, observation, because as we all know, behaviorists have this view that we cannot introspect what is going inside the mind of the person. What we can measure is the behavior at the end of the day. कि जो आप बिहेवियर में मुझे नजर आ रहा है, मैं उसके बिहाफ पे उसके बारे में तो बात कर सकती हूँ, but then what is going in your mind, I am really not able to make out. So for that matter of fact, behavioral assessments were given importance. We can have systematic observation, right? Naturalistic observation, but then at the same time the problem is
कि जब हम ऐसी ऑब्जर्वेशंस में हैं तो वी हैव टू रियली वेट फॉर दैट पर्टिकुलर बिहेवियर टू अकर. मे बी पेरेंट्स कम टू अस एंड दे से कि बच्चा बहुत ज्यादा टैंट्रम थ्रो करता है. कब करता है? जी जब वो क्लास के लिए जाता है, या मे बी एक पर्टिकुलर लेक्चर में, एनी एक्स वाई जेड, हिंदी, मैथ्स, मैथ्स ले लेते हैं, बच्चों को मैथ्स फोबिया होता है तो उसमें वो टैंट्रम एग्जिबिट करता है या वो बच्चों की कॉपीज खराब कर देता है. ओके, सो being a psychologist, okay, next day I'm going to the school ऑब्जर्व करने के लिए. ऐसा भी हो सकता है कि वो उस दिन वैसा ऑब्जर्व वो बिहेव ही ना करे. So I have to really wait for that child to behave in that manner, and then I'm going to record each and every detail. But then if I am being asked कि बच्चे के अंदर ADHD के कुछ साइंस नजर आ रहे हैं देखने को, अटेंशन डेफिसिट, हाइपर एक्टिव है, तो मुझे उसको नेचुरल टेंडेंसीज में ऑब्जर्व करना है. तो आई कैन सिट इन द पार्क कि बच्चा खेलते वक्त कैसा बिहेव कर रहा है, राइट. अपने स्कूल में है तो मैं विदाउट उसके नोटिस, या आई डोंट हैव टू वेट फॉर दैट पर्टिकुलर बिहेवियर टू हैपन. दैट इज लाइक उसके वो टेम्परामेंट में है, वो चलता जा रहा है तो मैं रन थ्रू ऑब्जर्व कर सकती हूँ. बट देन एडवांटेज है कि अगर वही चीज मुझे लेबोरेटरी सेटिंग्स में लाके करनी हो तो वो और भी अच्छी हो सकती है. क्यों? क्योंकि जो इरिटेशन या जो उसको फोबिया या फियर मैथ्स की क्लास में लगता है, मैं शायद कुछ इंडिपेंडेंट वेरिएबल को मैनिपुलेट करके वो क्लास में लेके आ सकती हूँ. बट देन आर्टिफिशियल सेटिंग्स का अपना नुकसान फायदा है. जो चीज मैं नेचुरल ऑब्जर्वेशन में देख रही, मुझे हो सकता है नेचुरल बिहेवियर दिख रहा है, वो शायद मैं लैब सेटिंग्स में लेकर ना आ सकूं. The limitation of this observation method is that maybe I can have little or no control. Of course, मेरा अपना partiality biasness हो सकता है. Certain expectations, ऐसा भी हो सकता है कि जी एथिक्स को मैं भूल गई हूँ फॉलो करना, और मुझे लगता है कि ये मेरे रिलेटिव्स हैं तो मैं इनके लिए जो ऑब्जर्वेशंस नोट कर रही हूँ वो मैं ठीक ठीक नोट करके दूँ. जो कि अगर मैं यही सेल्फ रिपोर्ट इन्वेंट्रीज यूज करूंगी या मैं ऑब्जेक्टिव टेस्ट जब यूज करूंगी तो उसमें वो उतनी मैं अपनी तरफ से बायसनेस नहीं ला पाऊंगी. Then we also have situational test. Now, situational test is a kind of in between form of a standardized test and the observational methods. They are the basis of observations only, but then you are given a situation. और वो सिचुएशन जो है वो आपकी डेली एक्टिविटीज से मैच करते हुए हम देते हैं. And at the same time, in this situational test, when the situation is being given, the subject has no idea that I'm being studied, I'm being observed in that situation. And then you are given the opportunity in that present situation to interact. For example, GD, ग्रुप डिस्कशन राउंड्स होते हैं, आपको एक रैंडमली टॉपिक में थ्रो कर देती हूँ. एंड role of media in increasing the aggression. So now I have to see कि आप उस टॉपिक पे पर्टिकुलर अपनी इंटरेक्शन कैसे करते हैं, क्या क्या व्यूज हैं आपके, कैसे वर्ड्स यूज कर रहे हैं, क्योंकि हम जो वर्ड्स, जेस्चर्स, माय बॉडी लैंग्वेज, वो सब चीज़ें उस वक्त मेरे पर्सनालिटी के बारे में एक रिफ्लेक्शन थ्रो करेगा. So the research says that the first situational test that was developed by US Office of Strategic Services during the World War II to screen out men for military assignments. कि given a situation जहाँ पे आपको डिसीजन लेना पड़ता है, आप वॉर जोन में पोस्टेड हैं और आपको विद इन अ फ्रैक्शन ऑफ सेकेंड्स कोई डिसीजन लेना पड़ता है, तो आप कैसे बिहेव करेंगे? आप पैनिक हो जाएंगे, आप सिचुएशन को संभालेंगे या नहीं संभालेंगे? जहाँ पे आपका रूटीन का आईक्यू काम नहीं आएगा, मे बी इमोशनल कोशेंट इज मोर इम्पॉर्टेंट. So what do we measure with the help of situational test? Leadership, yes, person who can take the lead. Domination, responsibility, you are an extrovert person or an introvert. Now they say that situational tests, they're also called as behavioral test, because one way or the other, of course, हम overt behavior को ही measure कर रहे हैं with that situational test. For example, honesty, cooperation, self reliance, self control, self efficacy, ये जितने भी फैक्टर्स या डोमेन्स हैं दे आर रिलेटेड टू अ कैरेक्टर ओनली, जो कि हम सिचुएशनल टेस्ट के थ्रू फाइंड आउट करने की कोशिश करते हैं. Now we have certain limitations and the strengths for the situational test also. Now these tests represent real life situations and therefore their findings can be generalized to natural life situations. रियल लाइफ टेस्टिंग होती है ना, सिचुएशन आपको दी है, आप उस सिचुएशन में कैसे बिहेव कर रहे हैं. सो नेक्स्ट टाइम वो सिचुएशन आएगी तो हम वो रिजल्ट्स को जनरलाइज कर सकते हैं, विच इज गुड फॉर अस. बट एट द सेम टाइम such kind of tests are time laborious, they are time consuming. We have to create a situation, you have to act accordingly, extraneous variables during that. If weather is given consideration तो weather act होना चाहिए. अगर इंफ्रास्ट्रक्चर मैटर कर रहा है उस सिचुएशन में तो मेरे पास वो इंफ्रास्ट्रक्चर होना चाहिए, मेरे पास प्रॉपर प्रॉप्स होने चाहिए. मे बी अगर मैंने कन्फेडरेट्स को एज पार्टिसिपेंट्स बना के डालना है बीच में डिस्गाइज्ड फॉर्म में, तो आई शुड बी श्योर इनफ दैट प्रॉपर ट्रेनिंग इज गिवन टू दोज कन्फेडरेट्स, जो कि मेरे रियल एक्सपेरिमेंटल ग्रुप को इफेक्ट ना करे और उनको पता ना लगे. सो अगर मुझे इतना पैराफर्नेलिया अरेंज करना पड़ता है तो इट मीन्स इट इज कॉस्टली ऑल्सो, इट इज लेबोरियस, ताकि वो सिचुएशन रियल लाइफ की तरह ही लगे, मैनिपुलेटिव ना लगे. देन चाहे जितना मर्जी हम कभी कभार ट्रेनिंग दिया होता है ऑब्जर्वर्स को, कन्फेडरेट्स को, कि यू हैव टू एक्ट लाइक दैट, बट देयर इज ऑलवेज अ चांस कि कभी कभार उस ग्रुप में वो जो पार्टिसिपेशन दे रहे हैं उनको हल्का सा आइडिया हो जाए कि ये लगता नहीं है कि अपने ग्रुप का है. लाइक फॉर एग्जाम्पल देयर इज अ मूवी जो शाहरुख खान का आया था, मैं हूं ना. उसमें वो रोल अडेप्ट करके एज अ स्टूडेंट बनकर आया था, बट वो बहुत डिफरेंट लग रहा था कि इतना बड़ा एजेड, राइट, और वो स्टूडेंट वाले कैटेगरी में लग नहीं रहा था, तो ही हैज टू पोज एज इफ के आई लेफ्ट माई स्टडीज और आई हैव दैट विश टू कंटिन्यू माई स्टडीज अगेन. ड्यू टू सर्टन रीजंस मैं कंटिन्यू नहीं कर पाया था. बट कभी कभार वो चीज़ें जो ट्रेन्ड ऑब्जर्वर्स होते हैं उनके पार्ट पे एक कमी रहती है, विच दे फेल टू keep a disguised form, and then can be an error or a threat to the real experimental group. Okay, they can start behaving in the same artificial manner that, okay, I am being observed. For example, you are in a marriage. So जब आप किसी के पार्टी में या मैरिज में कहीं जाते हैं फॉर्मल ये फंक्शन में, तो you are very normal, happy, enjoying the event, and when the dinner is being asked, being served, and जब वो फोटोग्राफ्स मूवी वो बनना शुरू होता है तो हम कहीं ना कहीं कॉन्शियस हो जाते हैं. ना चाहते हुए भी हमारी प्लेट से गिर सकता है. वी कैन स्पिल द ड्रिंक वी आर हैविंग. वाई? बिकॉज हम कॉन्शियस हो गए हैं. ओ, आई एम बीइंग ऑब्जर्व्ड. सो ऐसे सिचुएशन में क्या होगा? अगेन आर्टिफिशियलिटी. I have to pose very nice, being very gentle. Maybe otherwise I'm very wild when I'm with my friends. So इन सब चीज़ों का ध्यान रखना बहुत ज़रूरी है एक situational test के पॉइंट ऑफ व्यू से भी अगर हम दे रहे हैं, देन what to observe. Now they say there's a problem in situational tests which cannot be planned to study all behaviors of the individual. So selection of the meaningful behavior is always an important question. Situation तो भी बना ली है, लेकिन मैंने फाइनली मैं कौन कौन सी चीजों को, कौन से एक्ट्स या एक्शंस या टेंडेंसीज को इंपॉर्टेंस दूं और किसको ना दूं, क्योंकि हर एक्शन, उसका हर एक्ट जो है वो कुछ ना कुछ सिग्निफाई कर रहा है मुझे उसकी पर्सनालिटी के बारे में. तो नाउ हियर आई हैव अ प्रॉब्लम. व्हाई? बिकॉज इन सेल्फ रिपोर्ट इन्वेंटरीज और मे बी इन लेट्स सपोज आइजिंग पर्सनालिटी क्वेश्चनर, वहां तो डायरेक्ट एक सवाल पूछ लिया, आर यू ग्लूमी? तो ग्लूमी के हिसाब से ही मेरे को जवाब देना है, ग्लूमी वाला एस्पेक्ट टच करना है. या फिर यू रियली लाइक chilling or partying a lot? अच्छा, मुझे extrovert, अच्छा, I am not that kind of a person. Do you feel loneliness? Okay, I have to talk about that loneliness. But here, situation given, maybe एक altruism वाला situation manipulative बना के रखा है, तो I don't know which act or which behavior shall be given importance. So then again, this is a threat to the situational test. Then whether the observer should be kept visible or invisible. क्योंकि कभी कभार क्या होता है, the presence of the other person can create certain vibrations like your sixth sense. I feel I don't know this person, ये हमें ऑब्जर्व करने के लिए ही बैठा है यहाँ पे, क्योंकि हमारी बॉडी लैंग्वेज बता देती है. मेरा जेस्चर, मेरा फेस टू फेस कॉन्टैक्ट. सो अगर तो ग्रुप छोटा है, दे से द फिजिकल प्रेजेंस ऑफ द ऑब्जर्वर इन द ग्रुप मे चेंज व्हाट एक्चुअली टेक्स प्लेस इन द ग्रुप. बड़े ग्रुप में फिर भी ऑब्जर्वर के ऊपर इतना ध्यान शायद ना जाए, लेकिन छोटे ग्रुप में आप, क्योंकि वन टू वन इंटरेक्शन इजीली होती है, तो शायद आपको पता लग सकता है कि ये हमारे ग्रुप का है, या कोई ट्रेन्ड ऑब्जर्वर है, या कॉन्फेडरेट बन के आया हुआ है और हमें ये स्टडी कर रहा है. देन द रेटिंग स्केल्स. अब रेटिंग स्केल्स में क्या है, आपने एग्जैक्टली एक there's no correct response for certain attitude. एटीट्यूड को हम yes और no में नहीं कह सकते, बट एट द सेम टाइम हम कुछ ट्रेट्स, टेंडेंसीज हाई है या लो है ये जरूर फाइंड आउट कर सकते हैं. तो वो जो एक न्यूमेरिकल रेटिंग हम असाइन करते हैं रेटिंग स्केल में is also one method used to measure personality. Then the frequency count is also observed as one of the methods of measuring personality, where you count the frequency of certain behaviors within a specified time limit. And the research says that different educators, they make use of both these scales, ये rating scales और जो ये frequency counts हैं, ताकि हम कुछ ऐसे intellectual deficit behaviors या disorders के बारे में information ले सकें. So the special educators, not the educators otherwise I'm talking about, the special educators dealing with the disability problems or intellectually deficit behaviors make use of rating scales and frequency behaviors, where they try to find out, okay, let's suppose the person is having this ADHD problem, so what is the frequency or the intensity or how many times the person is behaving in the same manner, the child. So we can count that. Then even autism. ऑटिज्म में अगर बच्चा बोल नहीं रहा है, जो भी साइन लैंग्वेज यूज कर रहा है, टू व्हाट एक्सटेंट उसके सोशल स्किल्स डेवलप हुए पड़े हैं, और वो क्या हमें आगे हेल्प करेगा उसके बच्चे की पर्सनालिटी को मॉडिफाई करने में या कोई चेंज लाने में. So frequency count and जो rating scales हैं, they can really help us in that. So as I said, every test has certain weakness and strength. So we know observation method can have an observer bias. Situations can be tricky at times to be identified. We can have that observer bias. I cannot control each and every factor when I am in a naturalistic observation situation. Let's suppose बारिश ही होनी शुरू हो गई है. I can't control that. But where if I am conducting it in a laboratory, so I'm not worried for that कि भी rain hai to I cannot conduct the observation. Then even to some extent the standardization of situational test, I'm not sure. Maybe मेरे अब ये culturally universal situations होंगी या नहीं होंगी, यहाँ पे culture plays an important role. क्योंकि हमारा जो approach है वो collectivistic approach है और western culture का individualistic है ना approach. So then the situations will differ accordingly. So here the culture also plays an important role. Hello?
Okay, ma'am. Please do.
Sorry,
Please
sir.
continue.
Light problem. Hanji, hanji. So now, after going through these tests, self-report inventories, or we call them as behavioral assessments. Now, what is the purpose of conducting this personality assessment? One is the treatment or the remediation that we want. Why? Because this kind of psychological assessment is the first, at most necessary step in identifying, evaluating the strength of an individual, whether he's functioning properly, is he displaying his actions in an expected manner, or they are being displayed in an unexpected manner. Then certain developmental focuses are important for us कि भाई एक स्टेज में तो बच्चे के डेवलपमेंट में कोई दिक्कत नहीं आई अगर हम ADHD की बात करते हैं तो why in this second stage particularly or maybe why in this formal operational stage given by this Piaget. Then of course certain academic and school referrals. कभी कभार हमें स्कूल से लाइफ स्किल टेस्टिंग जैसे है लाइफ स्किल टेस्टिंग में ये सब पर्सनालिटी फीचर्स जो है वो इनकलकेट करे गए हैं तो कभी कभार हमें ये एकेडमिक पॉइंट ऑफ व्यू से लगता है कि बच्चों के पर्सनालिटी के बारे में जानने की ज़रूरत है सो हम ऐसे टेस्ट को यूज़ करते हैं एंड ऑफ कोर्स क्लिनिकल और प्रोफेशनल एप्लीकेशन तो है ही है जैसे MMPI MCMI CPI ये टेस्ट सारे हम डायग्नोस्टिक टूल्स की तरह यूज़ करते हैं देन कुछ डिसेबिलिटी एक्शंस को कंसिडर करते हुए जो बच्चों में देखी गई हैं उन चीज़ों को ध्यान में रखते हुए वी बिलीव कि यस the test, personality assessment test, are important. Then even case study method, that also plays an important role, of course. जिसमें आप आई एम श्योर साइकेट्रिक डिपार्टमेंट में ये बहुत इजीली केस स्टडीज के बारे में हमें सुनने को मिलता है कि द पेशेंट्स दे आर बीइंग यू नो इवेलुएटेड, उनका पास हिस्ट्री, उनका स्कूल हिस्ट्री, उनका रिलीजियस हिस्ट्री, उनका जो मेडिकेशन चल रहा है, उनकी फैमिली बैकग्राउंड, and many other miscellaneous concepts are being jotted down and considered as the history of the person before we put him or her under any diagnostic category. Let's say अगर personality disorders की ही हम बात कर रहे हैं तो case study method helps that. Then even the interview method, जरूरी नहीं है कि विद बस प्रोजेक्टिव टेक्निक्स ही हम यूज करेंगे, कुछ इंटरव्यू टैक्टिक्स भी होते हैं, कुछ ऐसे वर्बैटम होता है, कोई प्रोबिंग होती है, कन्फ्रंटेशंस होते हैं. लेट्स सपोज अगर थीमेटिक परसेप्शन टेस्ट की ही मैं बात कर रही हूँ जहाँ पे वो पूरा अपना स्टोरी लिखेगा, सो उस वक्त अगर मुझे लगता है कि कुछ सब्जेक्ट से मिस आउट हो गया है तो स्लाइट प्रोबिंग और इवन कन्फ्रंटेशन कैन बी अ helpful tactic to find out the details. Interview can be structured, unstructured, formal, informal. But then before we go for the personality assessment, we must have the basic blueprint of conducting the assessment. Before मैं final assessment के लिए अपने examinee के पास जाऊं, I must be aware and must tell my client or my patient what I'm here for, what am I going to do, right? Informed consent, that's also very important. What kind of activities or roles you would like your client to engage in, the instruments, the time that you are being used, the contract. कई बार होता है कि हमें कुछ वो रिटन में कहते हैं कि जी आप दे, हमारे वीडियोस नहीं लेंगे, आप हमारे फोटोज नहीं लेंगे, आप रिकॉर्डिंग करेंगे, तो वी हैव टू बी वेरी श्योर कि जी मेरे एकेडमिक पर्पस के लिए है. So all these things are very important before we go for the personality assessment. Before we decide कि okay मैंने objective test use करना है, एक simple blueprint या कह लो mental status examination होना बहुत जरूरी है हमारे पास, so that हम right test person के ऊपर use कर सकें. That's it for today. Can we take some questions now? Hello?
Ma'am, when do we submit our assignments?
I think this needs to be answered by Tejpal sir because he's handling all these queries. If any academic or regarding to some this topic, I can take up the query. I think he will orient you about the submission of your assignments. You can have your word with him later on.
Thank you, ma'am.
यदि कोई एकेडमिक पर्सन है तो आप बात कर सकते हैं और एडमिनिस्ट्रेटिव पर्सन्स के लिए आप मेरे से चर्चा कर सकते हैं. ओके, ठीक है. थैंक यू डॉक्टर साहब.
Thank you, sir.